Well, welcome back. I spoke with U.S. Senator John Cornyn earlier today, and tonight we continue our conversation. I asked him about COVID-19 testing in the Valley. Some are free, but with a large portion of our population living in poverty, I asked the senator if there are plans to extend testing services into colonias. Here's part 2 of our interview you'll see only here on Channel 5.
Well, right now, the Center for Disease Control says that you should get a test if you have some symptoms. In other words, you need to talk to your doctor or a healthcare provider, and they then recommend you. So it's not something that you would qualify for ordinarily if you don't have any symptoms. If you're feeling fine, there's no reason to get a test. But eventually, we may find that we want to broaden the range of testing and make it more available so we can find out who may have some immunity to reinfection from this virus. The challenge has been this has come upon us so quickly, and there's so much being done right now that we simply are taking it one day at a time.
Yeah, and I guess in going forward, and maybe the way to open it up, the economy and getting back to life as we used to know it before the pandemic, is that antibody testing that you have referred to. That is at least one way that you can find out, well, who's been exposed, who has some immunity, and go from there.
I think that's going to be a big part of it. And also a lot of the testing, the nasal swabs, and now you may not need to swab, you can spit in a container and they can test it that way. There's a lot of innovation taking place now, as well as scaling up the availability of testing. So we've had I think somewhere on the order of 6 million plus tests in America, the most of any country in the world. In Texas, we've had, I don't know what the current number is right now because it keeps going up. I think roughly 400,000 tests conducted. Right. The number of people who test positive is staying pretty steady, around 8 or 9%. And but fortunately, I think we're going to take this thing gradually. As we reopen, we're going to continue to monitor the situation and see if there are flare-ups, and we need to isolate people and quarantine them so they don't make others sick. Right. The thing we know that this does is it does affect elderly people and people with underlying chronic diseases disproportionately. So maybe we want to keep those folks quarantined, isolated, while the rest, the young and the healthy, can begin to get back to work.
Right. You know, on average, here in the Valley, some testing sites that have opened up, the fees for the tests are $75 and or about $140, $150 in that range. But some free testing sites have opened up here in the Valley, and you know our area, thousands of people and families living below the poverty level. Are there plans to extend these testing services to many of the colonias in the Valley? Some kind of outreach program, because what we're hearing right now, there's a lot of anxiety or fear of people not wanting maybe to seek medical attention or wanting to get that testing because they're afraid of catching the virus or a number of other reasons. What's your answer to that, Senator?
Unfortunately, this virus loves congestion, loves dense populations, and the colonias are a good example of that. So there is a danger there. We have tried to make as much free testing available, and people who do have insurance coverage, they've agreed to do it for free. But of course, what you're talking about is a number of people who aren't American citizens and who don't have insurance, aren't on Medicaid and the like. But I think maybe we should have at least some effort to go in and figure out what's going on, because what starts in the colonias will not stay in the colonias. And it's important that we contain this virus, as well as, I think, just from a pure humanitarian standpoint, help everybody we can.
Yeah, and several clinics here in the Valley receive some federal funds, and those clinics really zeroing in on the uninsured and low-income families here in Texas. Some officials have said, because of some things that you bring up, is immigration issues, the push for people to stay at home, and then you had the enforcement of curfews and stay-at-home orders and things like that out in the street. So they're telling us, and at least what we've heard, is a lot of their patients, again, reluctant to go and see them. They have the funding, but patient fees are another component to their survivability. So how do you think that's going to pan out? What do you think can be done, an outreach program to safely bring people in and get the medical attention that they need?
Well, since you raised this to my attention, let me promise you I will work with my staff to see if there's something we can do. We didn't want money to be a barrier to testing. We can't make people get tested who don't want to get tested, but people need to understand this is about their health. This is not about immigration. This is not about playing gotcha or anything else. Everybody in the community has an interest in everybody who has the virus getting contained and not spreading to other people, not to mention people who have the virus who are experiencing severe health conditions, to make sure they get the treatment that they need. So that's something we will certainly look into to see if there's more we can do.
And to catch the first part of our interview, head over to krgv.com/coronavirus. There you can also find all the unedited live Q&A sessions. Tim?